Assalamu alaikum. This is a case where we're dealing with an endodontically treated tooth, and it has this filling, huge filling on it. The endodontist told us that she placed a resin modified glass enamel base, and then this is composite filling. And what we have here is a radiolucency here, and we have a radiolucency here. So all of this is what we are presented with. Okay. So we have multiple decisions to place. One is, do we place a post or not? Okay, or not. It's either yes or no. We're going to also have to consider what is the type. Do we do a crown or do we do an endo crown? Okay. Okay. So multiple decisions. Do we need to place multiple posts? 1, 2. Okay. Are we going to do the crown with any modifications in the preparation? Endo crown, how deep are we going to go with the margins? Are we going to keep them occlusally like an onlay? Are we going to do an overlap or not? And so on. So all of these decisions are accumulating, and we do not see anything from the X-ray because the filling is covering. Okay. The filling is covering the borders of the tooth, so we're not able to see how much buccal dentin is there, how much lingual dentin is there, and so on. So my first comment was, when you do endo, please, when you, as a prosthodontist, when you cooperate with an endodontist, always make the endodontist take a photo of the tooth just immediately after filling the roots. Why? Because this photo will determine how much dentine and enamel is left. Because many times what happens with endodontists, and also this is another thing with an endodontist, so when you are collaborating with an endodontist, you want to give them 2 instructions. Please give me a photo immediately after root filling, okay? And reduce caries cleaning. Meaning, if there is affected dentine, leave it, please. Don't go for the maximum caries excavation and maximum caries reduction. So please leave the affected and remove the infected. Okay? You remember that this is acid affected, this is remineralizable. This is infected, this is friable, so they should know the difference between them. Okay. So give instructions to reduce caries preparation. Also give them an instruction to reduce the access cavity. So they do increase their vision into the field of their operation on the expense of dentine. Okay, especially the core dentine, inside, around the pulp, around the crown, beneath the enamel. It's on our expense as prosthodontists to replace all of that dentine. So please reduce your access cavity as much as possible. And if there is affected dentine, leave that for me to decide if I'm going to remove it or not. Okay? So endodontists, please reduce your access cavity. Don't make a very open access cavity on the expense of the dentine inside covering the enamel, because we know that dentine we should have at least 2 millimeters height. Do you remember the numbers for crown preparation? To any dentine to act as a frill effect, it should be at least 2 millimeter long, 1 millimeter width. Okay, so I want to preserve that in dentine. I'm not talking about only dentine that's inside a preparation, meaning that the tooth is hollowed by endodontist, and then I'm talking about this dentine. It's not only this dentine. Even dentine, if for some reason this was large, even the dentines under the enamel should be this thickness. What will happen if less than 1 millimeter is present between the enamel and the dentine? This is the cavity. This is enamel, external enamel, and the endodontist hollowed in the tooth. He left less than 1 millimeter dentine beneath the enamel. This enamel will fracture. Okay. So try to instruct your endodontist, please reduce your access cavity, please reduce the caries preparation to the minimum, only remove infected, leave other dentin for me to decide. Okay? Because they hollowed down the tooth, there is even no dentin beneath this enamel. So what will happen if you're going to do an external preparation of a crown preparation? Once you remove the enamel, all this dentin is thin, you will also reduce it. Although there is a lot of dentin here, there was a lot of dentin here. But because of the hollowing effect, we reduce it. So this is the reason why in endo, access cavities are straight into the canals system, okay? Into the root canal system. You should not hollow the dentin when you do access cavities for endodontics. Okay? So please instruct them. So if you are dealing with an endodontist, they keep hollowing the tooth, tell them please stop. Make only straight accesses from the root canal straight up. Okay? To preserve that dentin in the center. So they are working, they're perfecting their endodontics, they are reducing the survivability of the tooth because of the reduction of the dentin. So these are the instructions for endodontist. Take a photo of remaining to after root filling, immediately after root filling. You want to assess the floor as well. You want to assess the remaining dentin inside the cavity. Reduce your caries preparation and reduce your access cavity. What will all of this result in? And this is why I'm recording this video. All of this will result in, I will have enough. This is the enamel, okay, let's say a shell of enamel, and we know the shell of enamel buccally is the thickest. And by the way, they're looking at this thickest area of enamel and thinking we have a lot of tooth structure. It's not the enamel. What we're looking for is the dentin beneath it. Okay, so this is the dentin. So our decision, so they have an access cavity. So this is our dentin. Okay, we have an access cavity. We will see multiple scenarios. Okay, this is enough dentin. Let's say we have enough dentin. This is occlusal, and this is the thick proximal areas of enamel. Okay, then this is the root, and these are the canals. Okay, suppose these are the canals. This is the ideal scenario. So I have enough dentin here. Okay, now if I have this dentin is divided by 2, so please don't confuse them. We have above the cement to enamel junction is on the forcation area, صح? This is CAG. It's corresponding with the floor of the pulpal chamber, usually. Okay, so this dentin here, it's called pulpal dentin, pulpal chamber. So these were the horns of the chamber before the endo was done. So these are all the walls of the pulpal chamber. So this is the pulpal chamber. Okay, and this is the coronal dentin. So this is dentin of the pulpal chamber, around the pulpal chamber, and this is coronal dentin. Now, coronal dentin will decide how much we are going to prepare a clue from from this part up.
Okay.
This dentin will determine if we can place any Nair cores or amalgam cores or post systems with core buildup. These are determined here. So these are two different decisions. And this is why I'm recording this video. I want you to notice that this is dentin around the chamber, and this is the dentin that will cause us to decide if we're going to place anything as a core here and with minimal posts, like semi-posts areas going in. This is when we go to a Nair core, and we're going to the decisions of amalgam core when we had amalgam and so on. Okay, so this is the dentin that decides this area. There is another dentin that causes the coronal. This is the dentin of the coronal. So if this is enough coronal, enough pulpal, what do we decide? A composite Nair core is enough. We can extend it into the cavities 2 to 3 millimeter into the cavity of the root canal itself. Okay, so this will help in the retention because we have enough coronal. Now we don't have enough coronal. This is another scenario. So more coronal is reduced. Okay, but still enough thickness. Okay, maybe the enamel is reduced as well. We have lost this area, for example. Pulpal is well, but we have lost all of this. We don't have enough dentine here, so if we're going to prepare the enamel, if we're going to prepare a crown, we will lose this enough. So it depends where I reach that between the enamel and the dentine I have enough dentine. If I could do this, I could do a crown.
Okay.
Because I have enough coronal,
Yes.
I have enough pulpal chamber. Now I could go for a crown. So this is option 1, Nair core. Now option 2 is a crown. A crown has axial preparation. So I'm going to reduce all of the enamel. I'm going to go to this dent. So this dentine is important for me. This is crown preparation. I have to decide this before I have placed anything in the canal.
Yes.
This is why I told you have to assess the tooth before. Because if I don't have enough dentine, this is hollowed out. After I prepare a crown, with no dentine is left. So I go for what? Post and core.
Yes.
And even post and core, I might go for 2 post and core if I've lost more than one wall. Okay? So this will compromise. Go to the other scenario. So if I have enough dentine, I could do a crown over this.
Yes.
Single crown. But if I don't have, and I don't want to lose all of this enamel, what do I go to? I have good pulpal dentine.
Yes.
I go for the third option, which is an endocrown. Preserve all of this enamel thickness and dentine, even if it's a little bit reduced, but keep them as one section, and place an endocrown. Place a good base and make an endocrown in here. Okay?
Yes.
So my decision, is it a crown or an endocrown, depends on how much axial reduction. Old endocrowns needed a crown margin. Now the theory is no, leave all of the dentine and enamel present. Don't prepare it down here and make it over as an only.
Okay.
So we solved the problem of the thickness here.
Yes.
Okay? Suppose we don't have this case. We have all of this reduced, and even some of the pulpal chamber walls reduced. Pulpal dentine is also reduced. Definitely we have to go to cores, core, post and core, and the post, multiple posts even. The more walls we have lost, we will need multiple posts. We go for sectional posts, going to cast posts, no longer prefabricated post. Just went out. Okay, so blackout. Okay, we go for post. We're going for cast posts. We have lost a lot of pulpal dentine in the pulpal chamber. Okay, so all of these are our decisions. This is why it's very essential for you to see the tooth immediately after endo, given the instruction to the endodontist. Please reduce your access cavity. Please reduce your caries reduction. Only friable caries that might go and infect your canal. Other than that, don't remove anything. Disinfect the dentine as you disinfect the canal. Leave also disinfection material like sodium hypochlorite to disinfect the dentine here. And this is, by the way, the CaResolve technology, where we disinfect affected dentine if maybe there is remnant of infected tissue. But other than friable tissue, don't remove from the dentine, please. Make your access cavity as straight as possible. Don't go for the endodontist where they flare their access cavity on the expense of all of the internal dentine, core dentine. Okay? So this is my advice. Thank you very much.